Okay, thanks Dave for letting me do this video demonstration today. Today I'm going to demonstrate for you MamaNatalie, which is a birthing simulator. It was developed originally for the purpose of addressing Millennium Development Goals number 4 and 5, which were preventing or reducing infant mortality and maternal mortality during childbirth in developing countries. It's a low-cost birthing simulator. There was a lot of positive response from it, and so now there are a lot of people who are thinking it would be good in the United States as a very cost-effective birthing trainer for EMS, for nursing, for first responders, things like that. So the MamaNatalie birthing simulator is $750, and for the through 2012 we'll be have a promotion where it'll be a buy one get one program. So if you buy a simulator, then one will also be sent to a program in a developing country somewhere where there's a program going on. So there's the MamaNatalie, and then as well as the NeoNatalie, which is inside here. I'll show you here in just a little bit, which is another simulator. They can be used in combination, or they can be used, or the NeoNatalie can be used separately as a trainer. Included in the kit, you have a stethoscope here, a pediatric stethoscope, and so you can auscultate for fetal heart tones on the simulator. So the learner will auscultate here, and the operator wearing the simulator will be tapping on the plastic here to simulate the fetal heart tones. You have a suction unit here, award-winning suction unit that can be used for training and as well as for real childbirth for suctioning the airway, and then it can be reused, and so it can be popped open and cleaned and sanitized.
Very good. That's a nice.
So that this alone can have the effect of saving a lot of lives just in clearing airways for babies. There's a cap here to put on the baby once it's born. 2 pairs of gloves. This is an extra uterus that I'll show you after in just a few minutes how that's used. You have an extra umbilical cord. There's a simulated syringe here to simulate administration of Pitocin. There's a urinary catheter, so you can actually perform a urinary catheter on this. You have 2 bottles of your simulated blood. You have a fluid catch here to catch the fluids for the postpartum hemorrhage. And you have a couple of devices here that are used to catch the fluid to keep from making mess.
Yes. Okay.
You have a couple towels here to simulate drying and warming the baby. This tubing here, I'll show you here in just a few minutes. You attach this to the baby once it's born, and you can simulate breathing and heart rate.
Oh, very good.
So this chair here is going to simulate our mother giving birth. So the operator would strap the simulator on like so around their waist, and let me just show you a few of the components of the simulator here. So this bag here basically represents the uterus for the mother with the baby inside. This strap right here represents the cervix, so you can grip it real tight. It'll also hold the baby in place. Let me open this up here so you can kind of see. So the baby is inside. The uterus here. Our placenta is in here. It's connected with our umbilical cord connected to the baby. And so you leave this, the uterus, you want to kind of leave this bag unzipped a little bit so the operator can get their hands in there and manipulate the actual delivery of the baby as well as the placenta.
Okay.
Snap it here to keep it kind of closed. This is a fluid tank here. It holds 1.5 liters of your simulated blood. Again, one of the major objectives of the simulator is to teach procedures in managing postpartum hemorrhage. Behind the baby here, we have a bag that can be squeezed to simulate either a firm or a boggy fundus. So as I squeeze it here, it transfers the air into another bag, and so once you palpate from the outside, you can feel the fundus, either a firm or a boggy fundus. So I think we're ready to deliver.
Okay.
So we'll peel the skin back here. Oh, one more thing. There's a bladder here to simulate your urinary bladder. So put this back on like this. Strap it on. So going through the process, basically the two main objectives of the whole simulator is first of all communication between the birth attendant and the mother, as far as communicating when to push, when not to push, etc. And then also postpartum hemorrhage. So during the delivery process, it's good to get a little bit of water before you put the baby in, a little bit of water on the baby's head, a little bit of water on the inside, just to help kind of lubricate the process. But there's not a whole lot of resistance here. The operator can have their hands, so the operator has her hands inside here and able to manipulate the baby and the placenta. So we go through the delivery process. So the baby's delivered, you can feel fontanelles, frontal fontanelles, posterior and anterior fontanelles. Going through the birth, I'm going to have to pull a little bit here. So our baby is delivered. Use the towel, wrap up the baby, warm, dry, stimulate. You go through the process of cutting the cord. So you would clamp, cut the cord, so the baby's delivered, and you can kind of feel, it's filled with water, so it actually feels relatively realistic.
Like 4 or 5 pounds.
Right. So it feels like it just kind of has that mass. It feels like a real baby.
Sure.
So this cap on here has your fontanelles, and then you have your face skin here where you can get a seal, so you can use a bag valve mask, or you can do mouth to mouth, get rise and fall of the chest. There's also a clicker in here for chest compressions. So I'll put the baby down here. So once the baby is delivered, the cord is cut and clamped, then the birth attendant can work on delivering the placenta. So you have your Velcro there that's holding it in place. So there's the delivery of the placenta. We have a placenta here. They can examine the placenta. You can have a partial placenta, and so this part will be retained, and you can, they won't have to go in and get the rest of the placenta out.
Very good.
They have to examine it, make sure it's complete. There's a switch. Go back inside here. So there's a switch on the inside here that the attendant or the operator of the simulator will be able to have their hand inside, flip this switch either to a regular flow or to a heavy flow. Also,
now, when would they want to operate that switch? Before the delivery, during the delivery, after the delivery?
it just kind of depends on what the objectives are, but probably during the delivery, probably turning it on a regular flow, and depending on if you wanted to teach, the objective was for postpartum hemorrhage, the treatment of it heavy, you would flip it up all the way open, and then so massaging of the fundus. So the operator holding the simulator has her hand in here, so I can palpate, I can feel. When you want to feel that, you can feel the uterus is kind of squishy.
Oh, yeah.
So now, as I squeeze this bag here, you can feel it start to firm up.
Yeah.
So massaging the fundus is one of the biggest objectives there to stop the bleeding. Suctioning the baby once delivery is done. That's one thing I didn't talk about, but that's very important. So the bleeding, we talked about. Once the baby's delivered, to teach resuscitation, these tubes right here can connect right here.
Oh, yeah.
And so it allows you to do spontaneous breathing and also simulate heart rhythm through the umbilical pulse. So as I'm squeezing, you can see the rise and fall of the chest. As I'm squeezing the red bulb here, it gives you an umbilical pulse. So you can do the airway breathing and circulation for the baby. It's fairly realistic.
It works, yeah.
Yeah.
So,
So
little nodules.
no. So there's the veins and artery are not there, but let's see. So it also included. I talked about the extra uterus. So this is the extra module that fits in there. There's one already that comes inside, but there's an extra one that comes with it. So in a nutshell, that's MamaNatalie and NeoNatalie. One thing I don't think I mentioned yet is this backpack. Everything fits in this backpack. All you really need is water to fill up the baby, and water to create your simulated blood. Other than that, you're ready to go.
Very good.
You have any questions, comments?
No, I like this very much. This is a nice way to train people who are not
Yeah, not necessarily healthcare providers.
Yeah.
Right. It's a great it's a great introduction also to maybe some healthcare providers, first responders, things like that, as an introductory course.
Great.
So okay,
Thank you.
Thanks a lot. Appreciate it.